This new cardiothoracic center represents visionary leadership, hard work, and collaboration. It is a symbol of our mission to provide excellent, compassionate health care in the name of Christ. For many years, Tenok Hospital has been a beacon of hope for countless patients and families. We have strived to offer the highest standard of care, and with this new facility, we are taking a bold step forward in serving even more people in their time of need. This center is more than a building. It is a place where lives will be saved and transformed. Every heart surgery, every diagnosis, every touch of care will have a ripple effect across families and communities. With the rise of cardiovascular diseases worldwide, this center will meet a growing need in Kenya and across the continent of Africa. Your Excellency, sir, there are tens of millions of people across this continent of Africa and hundreds of thousands in Kenya suffering from heart-related diseases.
And so we're going to do heart surgeries in this building right here. But more importantly, my prayer and hope is that you change hearts forever. Not just in Kenya, as it's been shared, people are going to come from all over the world. This is going to be one of the premier heart hospitals in all of sub-Saharan Africa. You're going to have people coming here to the staff. This is an opportunity to change the world forever. If you want to change the world, you don't do it through heart surgeries. You do it from preaching the gospel. Every word of this is true. God loved us so much that he sent his only son, Jesus Christ, to die on a cross. And it's my hope that no one ever goes into that building and leaves that building without hearing that message, that Jesus died on a cross and his blood washed away the sins of the earth. That is the ultimate heart surgery. That's how you change the heart of man. That's how you change the world. Let's do it right here at Tenwick.
In the ministry, we have developed the second strategic plan for the prevention and control of non-communicable diseases, 2022 to 2026, which aims to reduce by a third the non-communicable diseases and prioritizes in prevention and control of cardiovascular disease. Equally, we've worked on the National Cardiovascular Disease Management Guidelines 2024, which are ensuring standardized and quality care access across the 6 tiers of the healthcare system. And in line with our commitment to universal health coverage, we have prioritized cardiovascular disease conditions in the Social Health Authority, which covers the 3 health insurance to ensure comprehensive coverage for all Kenyans and especially those affected with cardiovascular disease. For the community health systems, we have strengthened that, and through our community health promoters who we have capacitated and have strengthened the community screening programs with an aim to improve the prevention, detection, and management of cardiovascular disease.
We will be attracting a lot of medical tourism. And I mentioned the other day, Your Excellency, that this will be the India of Africa. Bomet will be the India of Africa. We will also have employment opportunities. I'm told once this facility is fully functional, it will employ close to 3,000 healthcare workers. That is very huge, Your Excellency. Business opportunities will also be opened up. Hotels will be booming. Kiosks will be booming. And all the other opportunities that are related to what a mankind requires to survive beyond medical services. Generally, we want to say Bomet will be transformed by this facility. The facility that has been commissioned today will transform healthcare delivery not just in Bomet, but in Kenya and beyond. Your Excellency, it has been mentioned that this facility is the one of its kind in Africa south of Sahara. Beyond healthcare, Your Excellency, the economic impact of this facility cannot be understated. I'm talking now as the governor of Bomet. having this facility in my territory. This facility will transform Bomet.
It is also an institution of specialized learning, which will contribute to the training of future healthcare professionals through collaboration with institutions such as College of Surgeons of East, Central, and South Africa. The center will foster research, and I have seen some of their facilities that will help us in training and innovation, and of course medical tourism, as has been said, further positioning Kenya as a leader in specialized healthcare. Universal health coverage and the bottom-up economic transformation agenda have strengthened local and international investor confidence in Kenya's prospects for sustained growth and the sustainability of investment across sectors. As a 4.5 billion investment in the healthcare sector, this facility tangibly reflects that investor confidence. We invite more public-private partnership to boost investment in the development of healthcare infrastructure and the expansion of healthcare services across Kenya. It is my intention to make sure that we have a fit-for-purpose health delivery system that leaves nobody behind. And it is also our intention to make sure that it is not discriminatory. For a very long time, people with jobs, people who can afford, are the ones who went to hospital. We want to make it universal, and we want to make everybody, including those who are vulnerable, including the poor, can go to hospital, be treated the same way all of us go to hospital and we are treated. The win-win outcome that comes when the state and the church work together, when the private sector and public sector work together in a collaborative manner, we get results that make everybody a winner. And therefore, I want to commend our mission hospitals across Kenya. They have come through, they have become reliable, trusted partners of the government of Kenya in the delivery of health. And I want to ask every Kenyan, wherever you are, the first step that you must take is to be registered. That way, we will have you in our database, and we will be able to begin the journey to make sure that we can account for every citizen, and we can account for whatever prevalence of diseases in different parts of the country, and prepare ourselves. Because it is said, forewarned is forearmed, so that we can prepare ourselves better to deal with the health challenges that face our country. So I'm asking every citizen, wherever we are, to make sure that you're registered. I'm very happy that we are making very steady progress. In the last 1 month, we have registered and brought on board 13 million Kenyans. We believe that this exercise can be concluded in the next 2 to 3 months. We should be able to have every Kenyan registered, so that we can be able to have the requisite information for us to undertake this very important program of managing the health of our citizens. Let me give assurance to the missionary community who have requested us to review their work permits and the visa requirements for them and scale them down. I want to agree with you that that is an area that is of concern to missionaries, and therefore we will reconsider our position and bring missionary class of visas to the level that you have requested, so that we can be able to continue to work with you as you provide service to our nation. The investment I see here speaks to the heart of our mission and agenda to make healthcare universally available and accessible to all Kenyans. Without a doubt, the official opening of the AGC Tenwek Hospital Cardiothoracic Center is a welcome and significant milestone in Kenya's ambitious journey to provide sufficient, efficient, high quality, and accessible healthcare. This investment is not merely a state-of-the-art facility. It is, and it signifies radical progress in our region by establishing an unprecedented standard in the provision of specialized care.